these are safe rooms. We can put a person with tuberculosis in it, and he is not or she is not going to infect anyone else as long as they're wearing a mask. Whereas right now, in every hospital that I've ever seen in a really poor setting, TB patients who are in the hospital are at great risk of infecting other patients and at even greater risk of infecting health workers who are there all the time. Hind is just an extraordinary person. You know, she's originally from Sudan. She's probably now seen as many or more patients than any clinician on the face of the earth dealing with MDR-TB, XDR-TB, and HIV.
And we are trying, actually, we cannot just keep the patient as we are keeping him in the prison, so we take him outside so he can go during the day or in the evening to go outside and have some fresh air. So they are very advanced patients, HIV positive, with very low CD4s. Some of them had CD4 4, 6, and 11, and as well severe side effects for MDR-TB treatment. So we are keeping them for a long time, but usually they will stay here for 2 to 3 weeks maximum.
Yeah. So explaining to him that the drug will take up to about 2 weeks to pick up, so he has to just relax and allow them to wait.
I'm a Doris Duke Fellow, so it's a year of clinical research, and I'm working on a community treatment program for MDR-TB. And so as part of that, we've come here to see how Partners in Health has been running their program.
This is the map with patient distributions across the Lesotho. And as you can see, the patients, they are everywhere. The introduction of TB treatment, it started in the lowlands before the highlands. So it is just in the few last years that the TB medication had been distributed to the clinics at the highlands. But we are seeing patients with confirmed MDR and as well with XDR from the mountain area. From our clinic in Nohana, had 4 cases with MDR, and other patient with XDR.
In Southern Africa, with combination of HIV and MDR-TB, and patients being so sick and no hospital being able to do it, what is happening by default in other countries, even in South Africa, especially in places like Swaziland and Botswana, is they go into a big hospital with everyone else. And with very high rates of HIV in the general population, lots of people were getting infected. So this is going to have to happen everywhere in Southern Africa where there's this kind of a problem. But the first thing you want to do is get them healthier, smear negative, and then get them out.